Over the past decade, there's been a dramatic increase in the amount of money, time, and interest devoted to the role of psychedelics in mental health. Of the many compounds being studied, to date the only medicine that's actually legal in a clinical setting is ketamine. And at CIT clinics, we've observed a really welcome shift away from these procedure-oriented ketamine clinics where patients are simply infused with a standardized dose of ketamine in a pretty unsupportive and clinical setting. And instead, shifting more towards an integrative approach where ketamine is combined with mindfulness training and really compassionate psychotherapy. This new approach is called ketamine-assisted psychotherapy, or KAP. And KAP is intensive, it's demanding, and it's profoundly effective for patients and equally rewarding for us as practitioners. And so at CIT clinics, we're committed to supporting all non-medical providers who wish to offer KAP to their patients in a legal, safe, and medically efficacious manner. So here's some examples for how we can support you in this process. Ketamine is a controlled substance and it requires a medical license to be administered legally. Now, given the effectiveness of KAP, some providers have been tempted to administer ketamine to their clients without a medical license. Now, they risk their professional license at best and even possibly criminal charges at worst. CIT Clinics is addressing this issue by enabling carefully vetted, non-medical providers to administer ketamine through the CIT Clinics medical license. Our goal is to support all qualified KAP providers so they can treat their patients legally and safely. For most patients, the hemodynamic consequences of ketamine administration are akin to moderately vigorous exercise. Ketamine is incredibly safe. However, when things do go wrong, they can result in extreme mental and emotional anguish and even serious physiological issues such as cardiac, liver, kidney, and respiratory distress. As anesthesiologists, we're trained to anticipate the worst, no matter how unlikely it seems. So providing KAP to your patients without a comprehensive clinical safety net, in our opinion, is taking unnecessary risks for both you as well as your patients. So when you provide KAP at CIT Clinics, you're able to hand off all the clinical responsibilities to a highly skilled medical team so you can focus your full attention on guiding your patient through their KAP session. As board-certified anesthesiologists, titration of intravenous medications, simply stated, is the essence of what we do. Say your depressed patient is on the edge of a breakthrough, and you'd like to deepen their experience as well as lengthen the KAP session. In this scenario, you simply push the call button, discuss your request with a CIT anesthesiologist, who then administers a bolus of an additional 10, 15, however much ketamine is required, and this all happens without you needing to get up or leave the room. Conversely, imagine a PTSD patient's session suddenly becoming heavier and darker than you believe they're ready for. Rather than muscle through it and endure the situation, you can push the call button. CIT anesthesiologist is by your side to turn down the infusion and discuss the possible administration of an anxiolytic to soften your patient's journey. In both of these scenarios, our goal is to support you and your patient so you can stay fully focused on your session and the healing process. Providing successful KAP sessions requires attention to many complex details. Ideal set and setting are the result of deliberate planning and execution, and thereby setting up the patient for an optimal experience. When you offer KAP to your patients at CIT Clinics, all of those details are taken care of for you. The rooms are set up for KAP with comfortable recliners, music of your choice, various lighting options. The environment is safe, and all of the standards of a medical clinic are met. Our staff is fully responsive to your needs: clinical, administrative, patient communication, and follow-up, and more. We worry about the details so you don't need to, so you can focus completely on your patient's road to recovery. I hope this gives you some insight into how CIT Clinics can support you. We're fully committed to supporting skilled and trained non-medical providers to be able to provide KAP legally, safely, and effectively. If you're interested in learning more about how we can support you and your patients, please don't hesitate to reach out.